Hey guys, Dr. Carver coming at you with another really quick video. Today we're talking about your feet and why you should absolutely be looking at them if you've got hip, knee, or lower back pain. Now you're probably wondering why we look at your feet when it's your hips and back that are hurting. It's pretty simple really. Your feet are your foundation. They decide how we walk, how we stand, and our overall posture. Just like if you had problems with the foundation on your house, your ceilings and walls can start to crack and your doors and windows stop closing like they should. When your body's foundation develops a problem, it affects everything up that kinetic chain from your feet all the way up to your spine. Now our bodies have a reflex called the righting reflex. It makes your eyes always want to stay level with the horizon. So if you get an imbalance or a postural distortion in the lower part of the body, it'll cause an area above it to compensate to keep your eyes and your head level. Now, the most common issue we see with feet is something called pronation. It's what happens when your arches begin to collapse and your feet flatten in certain areas. This causes your ankles to roll inward, your knees to rotate, and your hips to become uneven. Even your neck can crook to one side. Because of the righting reflex, we can see a lot of stress starting to add up as your body makes these compensations. This almost always causes pain. So, first of all, how do we tell if you've got issues with your feet? Well, if you've got really severe pronation, you can sometimes see uneven wear on your shoes. That tells you right away there's a problem. In our office, we take a really detailed measurement using a 3D laser system. It uses a laser to map out all the arches in your feet. You've got 3 in each foot, by the way. And it'll tell us if you've got pronation, if you're carrying more weight on one side, and what type of compensations are happening up the legs into the spine. It gives us a really in-depth postural analysis. So, once we know there's a problem, how do we fix it? It's actually really simple. We'll take your scan and have a custom prescription orthotic built. It slides right into your shoe and that's it. It corrects your pronation so all the compensations up that kinetic chain can level out, and as a result, your posture will start to stabilize. We use a company called Foot Levelers to build our orthotics. Our patients love them. They're soft where you want them to be and rigid where they need it, so they're super comfortable. They're custom built for your feet only, so the fit is always perfect. So if any of this stuff sounds familiar, I encourage you to go check out some of the research on orthotics. There's a lot out there. I'm going to leave you a couple of studies to read in the description. I think you'll find it makes a lot of sense to check out the feet anytime you get knee or hip or low back pain. So if you're liking these videos, give us a thumbs up, give us a heart. Feel free to share it, and please give us a call or send us a message if we can do anything to help. Have a great day. God bless.